Welcome to Pelvic Confessions. I am Dr. Kari Howe, joined by my co-host, Dr. Jean Shirakabrad.
On this show, we have conversations regarding pelvic health, women's health that women should have but don't often get into.
Each week, we'll present our topic as confessions that I've heard in the clinic or things pertaining to pelvic health. We always omit any type of detail for sake of my patient's privacy.
So as you can tell, the heart mugs are still here. So we're still recording in the month of love. I mean, I make a case that anytime there's coffee in my mug, it's love, but pause.
Cup full of love.
Yeah, that's still good. That's still good. Confession this week is a little bit different than our usual ones.
Yep.
We're going to take a different angle at love. So we're still talking about sex, painful sex, in that realm of painful intercourse.
Yep.
But we're going to take a different angle at it today.
Yeah, it's going to be my confession.
It's your confession.
My confession to you about painful intercourse.
So let's get into it.
Yeah.
What is your confession?
My confession is today I want to show you my top exercises that I love for painful intercourse.
Yeah. So you do love, right? Love exercise. But I feel like even like with the previous episodes that we talked about, there's still, it almost seems like it doesn't quite go together. Painful sex and exercise, right? That connection of two seemingly polar opposite aspects. But as I'm sure you'll cover, exercise is an opportunity to work on underlying causes and introduce things to the system that can help during sex. So talk us through what exercises do you like and why exercise for painful sex? Yeah,
so when we're talking about exercise for painful sex, again, obviously always nuances, but we're going to paint in broad strokes, so to speak, here today. The exercises that I'm prescribing are oftentimes implemented towards helping your pelvic floor muscles to relax and lengthen. And so usually we're implementing some type of diaphragmatic breathing and stretching to the pelvis to help open up that area and get some lengthening and relaxation.
Now, when you say stretching, you're not literally grabbing the pelvis and stretching it, right? You're introducing movement.
Yeah, hip opening positions, if you will.
Okay, because I can see someone listening going, wait, she's taking my pelvis and she's stretching it?
Well,
by wherever means necessary?
Sure. What I think is less known about the pelvic floor is how integrated it is into breathing. So that's our first step when we're getting women in, working on, can you connect to your pelvic floor through your breathing? So diaphragmatic breathing is taking a big inhale, using that diaphragm to help push down. And when you get that inhale, your pelvic floor muscles should actually drop and lengthen.
You said a word that I think is important to double back on before we get deeper into that. You said prescribe. And that implies that this is not just arbitrary exercises, right? This is not, or just general exercises. When you say prescription, that implies specificity.
Yeah, it's aimed at towards a very specific diagnosis with an end result that we're looking for.
So when working diaphragmatic breathing, what kind of prescription aspects are you looking at? Like positioning, repetitions?
Yeah. All of the above.
Okay.
Again, we're going to pull out the biceps, like going back to that analogy. When we have pain with intercourse, oftentimes those pelvic muscles have some tone and some guarding to them. And our goal is to get for them to lengthen and relax. And so prescription starting off is just having these women, can you take a couple diaphragmatic breaths every 1 to 2 hours during your day? Can you start thinking about engaging with these muscles frequently to get that tone to relax? The more frequent we can catch those muscles in that state of guarding and help them to lengthen or downregulate can be really beneficial. But it also can look like setting aside some time, maybe 2-3 minutes at the beginning of your day and at the end of your day, going through diaphragmatic breathing. We can also incorporate positions, which is where those hip opening positions come into play, getting somebody into child's pose or a happy baby pose or a figure 4 stretch. Anything that's really helping to open up that pelvis and get a little bit of slack and stretch to not only the pelvic floor, but the muscles around it can be very beneficial.
That's breath work is so valuable because it has so many tentacles or connections that you're using it for a very specific dose response in the pelvis and pelvic floor, like you said, down regulating. But there's secondary benefits, right? Like if somebody's having painful intercourse, then there's something called feed forward mechanism, right? That before the next time, there's already a natural guarding response, and breath work helps other aspects than just muscles too.
Yep. I always tell my patients that the diaphragmatic breathing is really serving two purposes. One, again, we're helping to mobilize those pelvic muscles, but two, it's helping to calm down your nervous system. That guarding response is very much a stress fight or flight response that your body can carry that tone because of that. And so implementing some breathing can actually stimulate your vagus nerve, which helps to get into that rest and digest. So it serves multiple purposes.
Las Vegas, is that what you said?
Las Vegas.
To Las Vegas. That'll help downregulate everything.
Or stimulate everything.
That's very true. Well, both.
Yeah.
It stimulates so much that you can't help but downregulate at some point. So breath work is great. Positions you mentioned. What else in terms of exercise that you typically like to see?
I mean, even just in general, getting up and walking. I think walking is so underrated. We have to keep in mind our pelvic floor has a function of serving as a sump pump. So literally taking the fluid in and out of that pelvis, up and down, your pelvic muscles contract and release to help get that blood flow and circulation in that area. And so majority of people sit and work, from home or in an office job and just staying in one position. We're not getting up and getting that mobility and that fluid in our joints and in our pelvic floor. And so even getting out for a couple of 5-minute walks, or I am always encouraging my women, can you at least stand up when you're on a phone call? Finding simple ways to kind of sneak in exercise in the sense of implementing it into your day-to-day routine.
Yeah, so we often talk about there's 3 categories. There's movement or being active, there's exercise, and then there's training. Right? Oftentimes, and particularly when it's pain that's so debilitating, the natural thought process is, well, because this is so intense and so painful, we have to do something complicated and incredibly specific to make it work, which is the case sometimes, like we talked about the dose response, but sometimes just getting movement, giving your body something, a lot of times triggers so many other positive aspects, and walking is one of those huge ones.
Yeah.
Any other thoughts come to mind when talking about exercise and painful pelvic?
I think the thing that comes to mind really is just the awareness and the connection to that area of our body. Again, we've reiterated this multiple times in our videos before, but you can't see it, you don't feel it. Oftentimes we're very disassociated to this part of our body. And so a little bit of awareness, a little bit of mindfulness and connection can go a really long way in helping alleviate pain and empowering these women to be in control. It's scary when you have pain, especially when we're introducing it with sexual functioning and not really know what's going on and feeling frustrated in our bodies. And so that first step of even, can you connect to this area? Can you be aware of it? Allows these women to maybe engage more so in curiosity than out of fear, which can, again, be calming to that nervous system and help alleviate some of that pain.
Yeah, I think that's such a great and important point to make, is that all the exercises that you're talking about, and all these exercises you'll be able to see, we'll have them on our YouTube channel and at restorepelvicpt.com. You'll be able to see Kari walk through them and actually kind of follow along and try them for yourself. But it feels good, right? These exercises might be one of the first positive feel-good moments for a lot of women that do them. And yes, there's the secondary benefits, and the goal is still to have pain-free sex. But it's such a nice positive step to be like, oh wow, I can actually move my body in a positive way, and feel good about it.
Yeah.
It's a good first step.
Yeah.
That's awesome. Well, if you are dealing with painful sexual intercourse or just pain around the pelvic region, these exercises that Kari confessed to loving are a great way to start, because again, it's the first steps to feeling good. And if you're seeing some positive results from that, then seeing a pelvic physical therapist is a great next step, because then it's about precise dosing. That prescription that we mentioned before is the great way to actually make that specific to you and your body. So if you're around Ellicott City, Howard County area, or if you're in Maryland and want to do a virtual appointment, you can head over to restorepelvicpt.com and schedule an appointment right on the website based on your availability and your schedule. As always, thanks for tuning in to Pelvic Confessions. You can head over to YouTube, youtube.com/restorepelvicpt. We're going to see a lot more of these videos. And of course, Instagram, where you'll see some snippets from this show and a lot more content coming at you at Restore Pelvic PT. For Dr. Kari Howe, Dr. Jean Shirokrabrad, we'll catch you again on the next episode of Pelvic Confessions. Cheers.
Cheers.